Vaccine mandate at Hamilton Health Sciences went into effect today, and up to 169 people who refuse to get the jab could lose their jobs.
While HHS wouldn't tell us how many people were fired today, it says notices are currently being processed. Nicole Martin joins us live with this developing story. Good evening, Nicole.
Good evening, Taz. Hamilton Health Sciences has more than 13,000 employees, and less than 2% declined to be vaccinated. And when it comes to backfilling those positions or hiring additional staff, a hospital spokesperson couldn't answer our questions today, saying they don't have that information at this time. As of yesterday, Hamilton Health Sciences says of their 13,521 staff members, 169 have refused to get the jab. 40 others were previously terminated. The hospital tells us those individuals chose not to comply with mandatory reporting or testing requirements.
At the end of the day, we work based on science in the health professions.
The move by HHS is one the Registered Nurses Association is applauding.
Kudos for your hospital. I go with Hamilton on this policy. I stand by it. We were the first to ask. We will continue to ask. In fact, we are asking that the passport be now inclusive of 3 vaccines.
At St. Joe's, those who are not fully vaccinated by February 21st will reportedly be fired. And in the hospital's last update, it shows there are 64 staff members who have declined a vaccine. Earlier this month, Niagara Health announced that given the intensity of the 5th wave, the executive team made the decision to pause implementation of the mandatory vaccine program.
The great majority of nurses, doctors, and other healthcare providers do not want to work next to a person that is not fully vaccinated. And by that, I mean the 3 vaccines, not even 2.
The Ontario Hospital Association saying these policies have not materially affected health human resource capacity, access to services, or quality of patient care. They say the truth of the matter is that challenges facing the province were present long before mandatory vaccine policies were implemented.
The great majority have left because they're exhausted, because Bill 124, that caps their compensation when the agencies are paying them double and triple the money.
And like Doris Grinspan, Ontario's NDP leader is calling on the province to act immediately.
They've done nothing to ramp up the recruiting of new nurses. They've done nothing in terms of making sure that those internationally trained registered nurses are able to practice in Ontario. They just don't want to make those investments.
Grinspan says more than 20,000 internationally trained nurses are waiting to work on the front lines. And the terminations come as Hamilton hospitals are under strain. Right now with HHS, there are more than 300 staff members who are currently isolating due to COVID-19.